Welcome back, everybody, to Two Girls Without Cancer. As you can see, we are just one girl without cancer today. I am Becky, and Ashley is unfortunately too sick to be here, which is too bad because she's going to miss out on a really great show. But I am excited because I am here with Claudia of My Cancer Diaries. She is a former breast cancer patient, so breast cancer survivor, now thriver, mom of three. So I'm incredibly excited about that as also a breast cancer survivor, thriver, mom of two. So without further ado, let me introduce everybody to Claudia. Hello.
Hi, Becky. Thank you so much for having me today.
Yes, welcome to our slash my show today. I'm very excited to have you here just to talk with somebody who gets it, talk to
Yeah,
somebody who's been through that breast cancer journey and who knows exactly what I know. We've gone through a lot of the same stuff and Ashley and I talk about this a lot on the show that people's experiences are so different. So, I'm sure you felt this too when you first got sick. Everyone had advice for you, what you should do. Everyone was an expert in cancer, even if they'd never had it, or even if they had had it. You definitely need to do this. You shouldn't do that. Why? Because it worked for them. Well, that's great. It doesn't necessarily work for me. So, uh, it's just nice to talk to somebody who's gone through such a similar experience and can empathize and sympathize the same way that I can.
yeah, that's exactly how I feel about when I talk to someone who went through the same or, a similar experience.
Yeah, people forget that like every body is going to respond differently to a different treatment. I feel like I beat this topic to death, but like, when I first got sick, my husband was like, "No, you have to do chemo and radiation. Like that's what it is." My mom did it and she was fine. And I'm like, "Okay, but I've also watched people do it and not be fine." So it's like, how do you
Yeah.
know what's the right and people really become experts. Everyone's a doctor all of a sudden when
Yes.
someone they know has cancer. And, I'm guilty of it too, because there's been a lot of people even now. I'm like, oh, you should try this, you should try that. But I understand at the end of the day, it's a personal choice. Everyone's going to do what suits them. My biggest platform is like people should, consider what their options are before just being scared into it. Like everyone is, terrified when they first find out they have cancer, when they hear that awful news and then they get rushed into doing something that they may not have wanted to do or haven't given a lot of thought to just because doctors really make it seem like if you don't do something tomorrow, you're going to die tomorrow. That's how I felt anyway. Did you feel that
I
same experience?
Yeah, I totally agree on that with you. I think like there's so many. I mean, once you hear, the words that pretty much turns your life and your whole world upside down, you're confronted with all these options, and it's
Mhm.
kind of like I thought I knew a little bit about breast cancer, but then I realized going into this, I didn't know much about it, and
Right.
and you have to make you have to make choices. Do I go this way or do I go the other way? But they all come with pros and cons, and then there's some grace depending with which doctor you're talking.
Hmm.
And I think one thing that for sure I learned throughout this journey, self advocacy, it's really really important. I don't know how you feel about that.
Yes, 1,000,000%. You have
Yeah.
to be your own advocate because at the end of the day, like, you are a number. I hate to say that. In the cancer world, you're a number, you're just another person who had it, but you to yourself are a human being, you're a person, you're special. So if nobody's gonna stand up for you, like, it has to be you.
Yes, no, I totally agree. And I think, I learned a lot. Of course, like, you have a team of doctors that
Mhm.
hopefully you trust. If
Right.
you don't be afraid, to search out for another opinion or another so that you know all your options. But I learned actually a lot just talking to other survivors. And
Yes.
this is why I'm so active in the breast cancer community, because when I was first diagnosed, I was giving this whole big pack of papers, with resources too that, I could turn to. And as a younger person, I was diagnosed when I was 41 and I had three small kids. They were like 3, 5, and 7.
Oh my gosh.
I didn't feel that, any of the resources really, they didn't really speak to me. They didn't
Okay.
reflect my reality. And that's kind of like why I started blogging about it.
Mhm.
Because as you know too, I mean, it's so hard to be just a parent, right? I mean, but then parenting and going through a cancer diagnosis is really tough. And it's just like that's where I started to seek out other women and others who were also caregivers to young kids. I mean, how do you tell your kids you have cancer? I mean, all these questions. When do you need care? I mean, your kids were a little bit older, but there are other challenges, right, when they're teenagers, because they understand so much more. Mine, I needed a lot of practical help, but I had no clue. I was just overwhelmed with the cancer diagnosis. And then there's all these other things that you don't know what to expect. You don't know how you need to organize help, and everything comes really fast. But at the same time, I think too, just what you said, it's so important not to rush into a decision
Mhm.
tomorrow. I mean, really explore all of your options, get that second and third opinion, talk to other survivors. I mean, usually, as you said, it's not like it doesn't, you don't have to, you shouldn't delay, of course, like a surgery or treatment, like
Right.
months and months, but, so that you have a little bit time to make a informed decision.
Right, and a thought out decision, a rational decision, because I found, here where I live and maybe where you live also, the first stop is to meet with the surgeon when you have breast cancer. That's your first
Mm-hmm.
stop, and I did that, and I'm sure he was a great doctor, everyone raves about this guy, but I found him to have a bit of a god complex, where he was the answer provider, he was the man who gave health to people, and I was merely a pawn with cancer. And so he told me what was gonna happen. He said, "Yours is too aggressive for surgery first. You're gonna do chemo first." And in my head, I was like, "This guy doesn't know me. I'm never doing chemo, like not in a million years." And he was like, "And then you'll come back, and then you'll have a full mastectomy." And I thought, "You're not cutting my boob off. Thank you very much." And then he says, "And then you'll have radiation. However, if after surgery the cancer's still there, you'll go back and you'll do chemo again." So I just thought, who is this guy? This guy doesn't know anything about me. And so I hadn't even had an MRI or anything at this point.
Oh,
And I thought,
wow.
yeah, all they knew is that it was HER2 positive stage 3. That's all they knew just from a biopsy. And so I left there and I was like, "Nope, I'm not doing it." I did my MRI, I did my bone scan, found out the extent of the cancer in the breasts themselves, found out if there was, any cancer in the bones or wasn't any. I think I did a CT scan as well, just to make sure there was
Mm-hmm.
no metastasized areas. So we were good. And so from there, I thought, what the heck am I going to do? Like, I want to go to Mexico. That was my thought. Let's get to Mexico. Let's go holistic for this. That was my big plan. Everything's going to be holistic. I'm going to take herbs and supplements, and the cancer is going to go away. And I did end up in Mexico, and it did help very much so. But I came back, and this guy was mad. He was really mad, actually. And I remember him saying to me, "You will have," this was a Monday, "You have until Friday to make up your mind if you're gonna go back and do chemo here, because the chemo you had in Mexico is not it." And he said, "Or I'm gonna give you a total mastectomy. I'm gonna take every lymph node in your armpit, except, like, normally they just take a couple and then biopsy them and make sure that they're fine, or do the pathology on them, make sure they're fine and clear." He said, "I'm gonna take all of them. You're gonna end up with lymphedema in your arm." And that's that. It was like a punishment for going to Mexico. And,
Oh, great.
and he said, "You have until Friday to make your decision." Well, Friday came and went. My husband said, "Did you let him know?" I said, "No, because this is my life we're talking about, and 4 days isn't enough to make a life-altering decision." And so a couple days went by again, and I met with the medical oncologist this time, and she talked to him, and I guess he wasn't having it and he dropped me as a patient. He said, "No, this girl, she's resistant," I was told. He also told me if I resisted the radiation, he would never give me a reconstruction.
Oh my gosh. So
So,
you guys just started off on the wrong foot too.
we really did, and I ended up with a
Yeah.
very lovely, kind surgeon who was open-minded, wanted to know what I did in Mexico, explained
Okay.
things to me, gave me an MRI, all the things. Um,
Yeah.
but, it's when you're in the situation, like, if I had been someone who was like, "Okay, I have to do it immediately," then I would have done something that I didn't feel comfortable with. I'm happy with the route I went going to Mexico. I really boosted my immune system so strong that I feel like I breezed through chemo. And I did chemo. I eventually did here. And it sucked, but I also feel like I was a heck of a lot healthier than a lot of people who do chemo because I had taken a few months to get my body really healthy. I was doing treatments to lessen the cancer in my body, the inflammation in my body, the parasites in my body. Like I had done all kinds of stuff before diving into it. And for me, and not everyone wants to go that route, and that's great for them. For me, that's exactly what I needed. The
Yeah.
people
So you did a mix of alternative and then
Yes,
conventional and some alternative. You did it all.
I did it all. When the day I got to Mexico, my holistic oncology team said, "You need chemo." And I was like, "No, I'm in Mexico. That's not why I'm here." And they said, "No, you do, because the type that you have is very responsive to chemo. And why wouldn't you?" And so I did it in Mexico and all was great. The cancer in the breast itself was gone after 4 rounds of their chemo and all of the holistic IVs I was on. And but the lymph nodes were still there. Lymph nodes are a
Hmm.
tricky one. You want to make sure that it's taken care of because those are going to spread it to the rest of your body. But yeah, but it really boosted my immune system. I felt great. I looked great. You would have no idea that I had stage 3 cancer. I was glowing. And I mean, having a tan helps as well. Being in Mexico, walking everywhere helps. Eating clean helps. All the things help, but you would never have known it. And then I came back and then I was strong enough to do chemo, but I felt like on my time it was perfect timing. But
So
I
that
didn't
was,
want to be
yeah, that was your choice to go that
totally.
route. Yeah.
I didn't feel good about being forced into doing it. I didn't feel good about having a deadline. You have until Friday to make the biggest decision of your entire life. I didn't feel good about that. How do you stand behind a decision like that?
Hmm.
So that's
Yeah,
why I've
absolutely.
become quite outspoken for advocacy.
Yeah. Yeah, I did a lot of I am a strong believer in whole person healing,
Yes.
just like you. I wouldn't have had the guts to go an alternative route. I did go into the conventional route, but I did consult with different doctors. So,
Yes.
kind of like you, I met with my surgeon in the beginning, but I didn't like her bedside manners at all. I mean, there was
Right.
just not a great match. And I felt, I had never been at the doctors. I've always been super healthy and
Right.
all of that. I mean, I just went to the hospital to deliver my kids. I've always been eating healthy. I've always pretty much the picture of health. Always been
Yes.
exercising, all of that. And then, suddenly you're standing there and they're talking about, a lumpectomy, a mastectomy, and you're like, what the hell? It's just very overwhelming, but it was also because the fit was really not right, and the breast surgeon was on a time schedule. I had all these questions, and
Yes.
she was just rushing through it and didn't want to talk about anything. She said, look, I'm a surgeon, I can only talk to you about a lumpectomy or a mastectomy. And I'm like, well, how should I make this decision? So that's, I almost stuck to her, but then her bedside manners just got worse. Like,
Yep.
talking to her, that's where I was just like, I decided to go with another surgeon.
Mhm.
Luckily, I reached out in my community, and that's something like I didn't think I would be like that, but because you, as a mom, you always think you can do it all
Of
on your
course.
you can do everything by yourself and you don't really need the help. until you do. And I had reached out in the community and, also looked if someone had recommendation, because I was one of the youngest one in my community to be hit
Mhm.
first by this, by breast
Mhm.
cancer. And luckily, one of our friends, her husband was a doctor and worked at the same clinic I was being seen, and he had a contact, and I ended up with a breast surgeon that, just the chemistry was a lot better.
Mm.
So I went into my surgery. Initially, I thought I could go the lumpectomy route, because I was like, well, if I can go less invasive, why not?
Mm. Of
But then
course.
the breast MRI revealed that, I had a whole more. I ended up with having three tumors. I
Mhm.
had multifocal invasive lobular carcinoma,
Mm.
and on my a year before that, I had done a mammogram, which was completely clear. It was my first mammogram at age 40.
Mm.
And, a year later, here I go, I had these two lumps that I found out by going to a regular checkup at my OBGYN, and she
Mm.
felt the lumps, but then they only spotted the two. The third actually never was seen until I did a breast MRI. And
Wow.
then, it was very clear that I was not even a candidate for a lumpectomy because I had three lumps in there.
Multifocal, yeah.
And I was so glad that I had switched my surgeon at that point.
Mhm.
And I think that's when I learned, hey, I mean, you can't just let yourself push into one direction. You really need to advocate for yourself. It's, this is your body. So you decided to go one route and I decided, but we both kind of like looked at our options, right? I think that's what is very important. And I also, so I was treated by, a team of conventional doctor. I
Mhm.
still am, but I added a lot of complementary treatments
Mm.
to my conventional treatments, which I felt were really, really helpful with coping with the side effects of chemo. And
Yes.
I mean, all kinds. I mean, even now, I'm still on hormone treatment because I'm sure, as you know, you're done with active treatment, but then cancer is not really over. I mean,
Right.
I don't know what your treatment plan looks like, but I'm in another 10-year on hormone therapy, and I'm also taking a CDK4 inhibitor.
Okay. Yeah, mine was a hormone negative, so I did not have to do tamoxifen or any of those
Okay.
hormone therapies for 5 to 10 years. I did the Herceptin, which was like an immunotherapy type chemo. I did 17 treatments of that, and then at that time they were going to decide if they wanted to do more or less, and they were comfortable with 17. Seems like such an odd number, but yeah, not the 5 to 10 years, luckily.
Yeah. Yeah, it's always kind of like, I mean, as I said, like everybody thinks you're done with active treatment, but then you're not really, I mean, I was put in medical menopause at
Course.
41, which is, way too early. And,
Yes, I
but
get
I felt, so that's when I realized, I mean, even already during chemo, I realized, how important it is to support your body with
yes.
really healthy foods. And we started juicing because
Mhm.
initially I went into, I mean, I did my mastectomy and I thought, I'm done. I'm gonna go be back to be normal. I didn't think I needed chemo, right?
Yeah.
And I was kind of somewhat really resistant. I mean, the surgery, yes, but then the chemo, I was really resistant to that. I had seen my dad going through chemotherapy, and I don't have any genetic markers, by the way, but
Mhm.
it's also 20 years ago, and that's why I was so scared of chemo. But I thought, I'm healthy, I'm strong, I'm just going to be doing fine. I went in for that first infusion, and I had all the side effects. I mean, really all of them, and everybody is different, right? But so I went back to my oncologist and we discussed the options, like, do we reduce the dose? And I
Mhm.
was like, well, I don't really, why don't we start looking into alternative stuff? And that's when I really started digging into options, like, talking to other survivors. And I
Mhm.
started, I don't know if you know the book Radical Remission from Kelly
Yes,
Turner.
I have
So
it
that,
somewhere.
yeah, so that's something that really inspired me, because there's a lot of survivors that they had far way more advanced. I was early stage breast cancer, but there were way more advanced cancers, and they went the complete holistic route, and they
Mhm.
went into remission. So it's just kind of like it inspired me to seek out complementary treatments
Mhm.
to deal with the side effects. So we started juicing. I started having like treating food more as medicine, and all of that helped. I mean, I started icing my hands also for the
Yeah.
preventing the neuropathy and sucking on ice and all of that. And as I said, like the food. And the next round I went in, I didn't have any of the side effects,
Wow.
much to the surprise of my oncologist. Of course, she
Mhm.
didn't ask me about it because she's a conventional doctor, and I was really like fatigued too in the first round. And I started reading about beet juice. I started juicing beets, and because I read somewhere that athletes take it to improve their performance. I'm like, well, maybe it helps with the fatigue too. So, I
Beets?
was just, yeah, beet juice.
Oh, beets. Oh, okay.
Beets, yeah, beet juice.
Okay, I they meant
Red beets.
beans.
No, beets, yeah.
Yes, yeah, that would be
And,
delicious.
and so it was like, a few things that we did, the juicing, but also had a certain regimen that I was following going through chemo at the second round,
Mhm.
that was really gentle with whatever I ate. And I cut out dairy at that point too. I didn't
Yes.
realize either that I had become dairy intolerant.
Yep.
So, all these things that the conventional doctors didn't really tell me about. But then
They
I
don't
went into
care.
the second treatment and I was like, wow, I mean, I had better energy. And then the last three rounds, I felt a lot better. Instead of being more fatigued, I actually felt much better than in the beginning, the first round, because I
Mm.
didn't suffer the side effects. I didn't even have, I mean, I had rashes, I couldn't swallow. I mean, just all of them. I had like allergic reactions when I went in. I mean, I really had them on. That's why my oncologist is like, man, you just don't tolerate this. We got to reduce your dose. So, but we ended up not having to do that
Wow.
because we tweaked, things that I was doing and eating, and just from reading what can I help to support my body. And that made a big difference. And that's when I started to be a big believer of adding to add complementary treatments to your conventional treatments.
Yes, I agree 100% with that. Like, I do think there is definitely a time and place for conventional medicine, doctors. I'm not against doctors by any means. What I think is that the cancer market is very reactive, where it needs to be very proactive in
Yeah.
that we need to be preventing this before it even gets to this point. And if it gets to this point, like what can we do holistically to at least help you get through this? It doesn't just have to be take chemo, which really like sucks the life out of you.
Yeah.
And it's poison. You lose your hair because it's poison. You no longer can tolerate dairy because it destroyed your guts. Like
Yeah,
it,
exactly. But my doctor didn't tell me.
no,
It
why
didn't
would
tell me about it, right? So that's the thing. So I think you get much easier through it if you have that whole person healing approach. As I said, I'm a total believer in Western medicine. I believe that Western medicine did save my life,
yes,
but there is definitely a place for adding complementary therapies to your conventional treatments,
yes.
just even with coping with side effects. And to this day I am still doing complementary things that help me with all the side effects that I'm
Mhm,
suffering through hormone therapy and the CDK4 inhibitor, which is a targeted therapy that I'm still on.
mhm.
And it does help enormously, just kind of making that self-care a priority, whatever that looks like for you. I mean,
Mhm.
that's the thing. Not everybody is the same. You know, something that could work for me doesn't work for you, but
Mhm.
it's really about taking the time and finding things that work, you know, like
Yeah.
whether it's exercising or diet or you know, juicing or mindfulness practices.
Yeah.
But at the end, they all add up. All those little things that you do, they add up and they help.
I know that, throughout treatment, throughout the journey itself, the people that I met were saying, "Your attitude is everything. If you're negative through this experience, like, it's going to be a negative experience. If you're grateful and positive and have just, laughter and things like that." This is even coming from doctors and nurses at the cancer clinic after they would meet me and they would say, "You have the right
Mm-hmm.
attitude for this. It's the people with that attitude that survive." And not saying that people who are joyful don't pass away and people who are negative don't survive. I'm not saying that at all.
Mm-hmm.
But I think like your disposition and your demeanor really changes your experience. Like, don't get me wrong, cancer was awful. Like,
Yeah.
going through treatment was awful. When I say breeze through chemo, like, it was still a horrible time in my life.
Yeah.
But looking back, it was just a season of my life. It was hard, but I feel like I've done harder things, like, in different ways, emotionally harder in different ways, and physically, maybe that might have been the hardest thing, but yeah, I agree with you. The combination therapy is really, really helpful, and not just taking supplements, but attitude, exercise,
Yes.
surrounding yourself with good people, trying to stay in an optimistic mindset is really
Mm-hmm.
everything. I would get down on myself. I lost a friend with breast cancer while I was still sick, a girl that I had connected with, and that was hard, and I got pretty down. I was in my room, lights off, crying, and my husband was like, "This is not your story. This is not You're not the same person. So don't just feel like because you have a similar situation that means that this is going to be your fate also." And that, helped me kind of pull it together back into more of a positive mind frame, but it was
Yeah.
hard. It was hard there.
Yeah, I bet. Sorry for your loss.
No, it is what it is. I've met a few people along the journey now who have passed, and it does get in your head, of course.
Yes,
Like,
no, it does. I agree. I mean, you hear from,
mhm,
because once you're in the cancer community, somehow you do meet a lot of you
mhm.
do need meet a lot of cancer survivors, right? And then some are here to stay and some are not here to stay, and it's
Yeah.
I mean, you have to deal with that too. I mean, there's the survivor guilt too. I'm
Oh,
sure you know all about
yes.
that.
Yes, the friend who passed, I talk to her husband occasionally, and he always wants to know, "How are you doing?" "Oh, that's so amazing." And I'm like, "I feel bad telling you this." He goes,
Yeah.
"Why?" Even at her funeral, he's asking me how I'm doing, and I'm like, "I don't wanna talk about this, like, I feel
Yeah.
awful." And he was like,
Yeah.
"Why?" He's like, "You're getting better, this is amazing." And, over the last 2 years since I've been sick, there's 4 people that I, have gotten closer to who've passed of cancer, and it does get in your head. And so Ashley and I, this is why, part of the reason we started this show was because we really felt alone in this journey, and her and I were the only people left really of the people I'd connected with, but the only people that could understand each other's story. And,
Yeah.
even though we have very different situations, she had neuroendocrine cancer, I had breast cancer, very different life,
Hmm.
very different treatments, all the things, but, she understood what I was going through. When I said I was too tired to do something or I mentally didn't have it in me this day to do whatever, she understood. Where maybe your other friends might be like, "Come on, just go. You can do it. You're fine." That kind of stuff. So, yeah, it was hard for sure. It is.
Yeah.
And, like, the doctors don't prepare you for those side effects, like you said, the after effects, what could happen. I didn't even know neuropathy was gonna be a thing, about icing. I learned it right before I started that I needed to ice my feet and my hands and my mouth, and, thank God that I bought the ice gloves and the ice boots because I didn't get it in my hands, but although my tongue, I got it pretty bad, like, the burning, um,
Yeah.
the
Yeah.
first
But
time.
I felt like there was just not, it's a shame that there's almost no guidance on
Yeah,
these things. I mean, I was just brushed on the side. Let's say, like I was said, okay, you're going to start chemo that day. And then, oh, by the way, you have the option of doing cold capping and, to prevent neuropathy with ice gloves and boots. I had no idea how to do it.
right.
It's just like this information was just kind of thrown at me, and going through the journey, I've met a lot of other,
Yeah,
survivors too. They had the same experience. There's not really guidance. Well, I mean, how do I actually use this stuff? And I couldn't ask anybody either. I didn't know anybody,
you know anyone.
either. So that's when I turned to, researching it myself. I mean, finding
Mhm.
out like how can I prevent that? Because I was kind of picking it's which one is the worst side effect, right? I mean, yeah, nobody likes
Exactly.
to you lose their hair, but I for me personally, I thought it was too much to ice my head and my feet and my
Oh,
hands.
it's
So
awful.
I picked my hands and my feet, and I ended up having allergic reactions. The two first infusions, I could only tolerate the drip really slowly.
Oh
So I
no.
sat in my chemo chair for 7 hours with those ice boots and gloves, just because everybody is very
Oh
different.
my gosh.
I tolerated it, but and I never got neuropathy, but I kind of picked my options. I was like, okay, my hair, hopefully it's gonna grow. I'm 3 years out. Here it is.
No, that's
It
hard.
came back. It came back, and but I can't reverse neuropathy. That's kind of like my thought
Yeah.
process that I went through, and that's when I was like, when there was a side effect that I didn't want to live with. That's when I started digging into what can I do to prevent it. And
Mhm.
the same thing with the mouth. The first time I didn't ice my mouth,
Mhm.
and I couldn't swallow anymore. So the
Yes.
day after the first infusion, it just the food wouldn't get down. It was awful, and it was
Mhm.
full of mouth. My mouth was full of mouth sores.
Yeah.
So I did ice my hands and my hands and my feet, but I didn't think about sucking on ice,
Right.
something like that. So it's kind of like learning by experience and reading,
Mhm.
and it's just a shame that there's not more guidance when it comes to little things like that.
For sure. Yeah, I had known to do my mouth as well, but I just kinda casually chewed the ice. I also didn't enjoy it. Chewing on ice doesn't feel good on the teeth, and so the next time I was drinking, like, some ice water, it wasn't great. I eventually turned to I got, like, a jug bigger than this, and I had my husband fill it with a slush, like a Slurpee. And,
Yeah.
um, a sugar-free one, and I found that was gross too, like, just constantly drinking that. So by the last 2 rounds, I just took that same huge jug, just filled it with a ton of ice, tons of water, and just drank ice water, and that definitely helped those last couple rounds. Yeah, my first round, I say I breezed. The first round was horrible. They did have to drop my dose down. They said there's an acceptable level, a scale, and they start up here, but they can go down here. So the first
Mm-hmm.
round, I had had all the mouth sores, thrush. I got thrush. I got ringworm. I had these 2 weird
Oh
spots right
my gosh.
here, ringworm. My face was absolutely covered. My face, my neck, my ears in acne. I was passing out, diarrhea like crazy. Um, like it was horrible, horrible. And then they changed the dose and then it was tolerable. The only thing I had was basically diarrhea and sore mouth kind of for the rest of the time. But
Mm-hmm.
I was never nauseous. I never threw up.
Yeah.
I just kind of felt hungover for 3 days and then I kind of
Yeah.
went back to being myself again.
Yeah, I had sort of a similar experience. I mean, for me, with the diarrhea was really
Mhm.
bad with the first, but I didn't realize either that I was lactose intolerant because nobody told me that that could potentially happen till afterwards. I had to find out myself and go to my oncologist. I was like, by the way, is it possible that I'm, oh yeah, that can definitely be. It's just like, things like that. Why not? If you know that this could happen, why don't you tell the patient, hey,
Mhm.
look into this,
Literally.
maybe cut out your dairy? I mean, it's just like little things that can make your experience. And then I had a certain regimen that I was following, like, I had like purple potato that I was bringing to my infusions. That's the only thing I wanted to eat. like
Oh,
right before, like as a breakfast, and then I did like rice and chicken and ginger for 3 days straight. Like it's
wow.
just, and that's what worked for me well. And I started at the same time I started doing my bee juice to just help with the fatigue, and I just did so much better. It's just, it was a big difference for me
Yeah,
without having to drop the dose. But a big thing for sure was the dairy, and everybody's experience, is very different. But I definitely wish there will be more guidance from the
100%.
medical team.
The one thing I had to learn through the process was, did you get the immune boosting shot the day after? Or
Oh
the
yeah,
and then
yeah,
it gives
the
you
white, yeah, the new
yes.
Leicester
Yeah,
shot, yeah,
Neulasta. So they give a shot to people to boost their immune system, right? The day after chemo, or I think it has to be within a couple days or whatever.
yeah.
It makes your bones hurt a ton. Your
Oh
body
yes,
pain. Someone had told me right before I started that if I take a Claritin, so an antihistamine, leading up to this, it would help with the bone pain. But this girl had gave me really good advice. She said, take it for 5 days leading up to it. Then you have your chemo day, and then you take it for 5 days after. So each pack was 10. So I had to do one pack every round. But that 10, it made it so I had no bone pain at all, not even a little
yeah,
bit.
that
I
helped
also
me too.
yes, but again, doctors don't tell you that. I also met a lady recently who had gone through it, and she was using, glutamine, like the amino acid glutamine,
Hmm.
and it completely got rid of all of her bone pain, which makes sense because it's meant for repair after, like, a workout.
Yeah,
Um, so that's a very interesting one. I wish I'd known about that as well. Some glutamine, some antihistamines, that would have been cool
yeah.
to try.
Yeah, I mean, just as I said, like it can be little things. I did like I had horrible muscle pain too, like kind of like when you come down with the flu,
Mhm.
and just the muscle pain and the bone pain together. As I said, I did the Claritin, which helped some, but then for the muscle pain, I started doing like soaking Epsom salt. So I started taking Epsom salt bath. I had this whole routine like with soaking in Epsom salt bath after the 3 days after following chemo, and I felt that all helped also with my
Mhm.
aches and pains from the Neulasta shop for sure.
Yeah, it's helping you detoxify as well.
Exactly.
Yeah, had heard though, like you because I was doing coffee enemas, I had learned them in Mexico, and then I came back and I was doing them here, but I had heard you don't wanna do them during chemo because it's removing the medication too fast from your system, and even though chemo is horrible and does damage in your body, it's also doing damage to cancer, which is what you want, so you don't wanna eradicate it too fast. So, I had stopped doing them, plus with how damaged your guts are from it, it
Yeah.
doesn't feel very good, but yeah, the holistic route in complement with the conventional route, I really think is a winner.
I
Doing
agree. What made you decide to, you started out kind of alternatively. What made you decide to go conventional plus, complementary?
Well, so I was gonna just do all holistic, right? And I said
Yeah.
my doctors in Mexico told me no, that I needed chemo. And so, I was on board for their chemo. I didn't lose my hair, I didn't feel sick, nothing like that. And it was working, but it's very expensive down there for chemo. I'm from Canada where this is all free, but in Mexico, it was not free for the chemo drugs, the Herceptin and the chemo specifically. Very, very expensive. So I just basically ran out of money. I came back and I just thought, what am I going to do? Like, I need to figure out something. And then I still sat on it for another month before I did anything because I was on tons of supplements at this point, tons of things to take down inflammation and help with parasites and just boost my immune system, but it wasn't quite enough. I needed a kick, and so that's why just one day I was like, I can do hard stuff. I'm okay. I can do it. And so I just said, okay, let's do it. And so I did the chemo and then I did the surgery. And my doctors in Mexico always said, "You're gonna need a mastectomy, you're gonna need chemotherapy, you're probably gonna need radiation." So even though they were holistic doctors, they knew that the
Mhm.
course that I also needed to take just based on, what my diagnosis was. I also was multi centric. We had biopsied 3 tumors. I think they had found like 7 or 8 of them or something, like
Oh,
quite a
so you
bit.
also had multiple ones.
Oh, yeah, in 3/4 of it, and then they thought they found some on the left side as well, and then I was like, "Oh my gosh, like, what am I doing? How is this possible?" Because I wasn't even sick, I was perfectly healthy, but, obviously not, and there was no lumps, I never felt anything, ever. The
Did
only
you have did you have lobular breast cancer or
uh,
ductal?
ductal.
Oh, yeah, ductal. Okay, because lobular, it can actually, it's kind of common. It doesn't always form a lump. That's something I didn't know either. I can just see it be a breast thickening, or, sometimes you don't even, they kind of feel, the tumor is not like doesn't form lumps. It usually, it's
Mm,
kind of like in the miltox, it has this spider-like
mm,
structures. It can be
interesting.
even layered. So I had never heard about that, but it's the less common cancer, lobular, than
Yeah.
ductal. I think only 10 to 15% are lobular
Oh,
cancers.
wow.
And and they don't show as well on
Oh,
mammograms either. That's kind of like a typical too of lobular cancer. I mean, of course, now I know all that,
mhm.
and it's kind of like that's another thing I'm passionate about, to share awareness about this,
Yeah.
because I had never heard about it. I thought it was for sure always just creating a lump, but then there's another type of breast cancer, doesn't always form a lump.
Yeah, I had no idea, couldn't feel anything. It wasn't until after those 3 spots were biopsied that I was aware that there was lumps there, because they were probably so inflamed from being poked, and then I could feel them all the time. They were actually quite sore after that for months until I,
Wow.
started doing the treatment. But yeah, my nipple just went flat one day. It just kinda
Oh, that's what.
that's it.
Yeah.
It just tuck I just thought my bra was too tight. I had large chest. I took off my bra one
Yeah.
day, I looked down, I thought, "Oh, okay. Whatever."
Wow. So that was your only sign that you had, was a flat nipple.
Yep, and it just didn't come back out the next day, and that's when I thought, "Okay, that's not a
That's
great
weird.
sign," and so I just Googled it nonstop, and I talked to my mother-in-law who had breast cancer, and she was like, "I don't think it is, it doesn't sound like what I had," and then I started to get armpit burning a few days later, and I thought,
Okay.
Okay." She thought maybe it was mastitis, and so, I think I took some cabbages, I, like, shoved some leaves up there,
Sure.
um, but no, nothing. So, yeah, just, some of us are just luckier than others, I guess.
Exactly. Exactly. Yeah.
Okay, well, we do have to end pretty quick here, but why don't you tell everybody where they can find you if they want to follow your socials or your blog?
Absolutely. So, everybody who's listening, they can find my blog under My Cancer Diaries, and my blog is specifically for women who are going through breast cancer treatment, but who are also caregivers of
Mhm.
younger kids. And as mentioned here to Becky, I'm also a true believer in holistic, treatment, and that's kind of like what I talk a lot on my Instagram at my_cancer diaries about. I mean, everything that goes into healthy living and survivorship, and how you become a thriver after you're done with active treatment, while
Amazing.
also balancing your family.
Amazing. Yeah, it is not an easy task. There's a lot of
No.
juggling. There's a lot of
Yes.
juggling and a lot of repair, a lot of emotional repair after
Yes,
one
it
goes through
is.
something like this. Well, thank you so much for being on our show. I on behalf of Ashley and I, you're amazing, and we just wish you all the health and happiness and, just a amazing life from here on out,
Thank you to you too. Absolutely. Thank you so much for having me on the show.
of course. Wow, like, such an inspiring story. I love these tales of I don't know, success. Not saying not everyone's gonna get that with cancer, and that sucks. I hate that because everyone deserves that with cancer. But I'm so proud. I have such a special place in my heart for people who have gone through this and battled and have come out not only, successfully, but like stronger, wanting to help others with so much knowledge. So, you have to look at it like there was some light at the end of the tunnel. Cancer is a horrible disease. The treatment is horrible. But if there's some positivity that can come from it, then, is it worth it? Maybe. Anyways, check us out on all of our socials. Two Girls Without Cancer. Make sure it's without, not with, because we are no longer identifying with cancer anymore. That's why we changed our name. And of course, check out Claudia at my_cancer diaries. That's her Instagram. That's her main posting platform. Check her out. Send her a message if you need help holistically or needing, just someone to help you walk through it, give you some advice. Check her out. Check us out again tomorrow. No, not tomorrow. Tuesday. What day is it today? Oh my gosh, I don't even know what day it is. I have no calendar in front of me. Anyway, check us out next week when we are posting again with another amazing guest on our show. Bye.